since the 31st of December in 2019, we have started this war with the COVID-19 virus. In fact, we have been always very proactive in terms of preparing for the epidemic when the virus has not arrived Hong Kong, and also making a lot of response and also stringent epidemic measures in terms of border control measures, preventing the virus from spreading within the community, social distancing measures, and the latest is the preparation, the procurement, the preparation of vaccination, for COVID-19, COVID-19 vaccine for the people in Hong Kong. So I think we have always been very proactive, but as the epidemic is not static, it has always been moving. And so when it evolves, so it is all an evolving situation. So when it evolves, every time when we have more information, when we have better experience, when we have more capacity, we can actually, response, put in more response measures. Well, I think it's the delivery of the vaccine. So, for example, the BioNTech vaccine, we have already the independent expert committee have already recommended to the government, and very soon we are able to authorize the vaccine. But in terms of the delivery, so we have to rely on the vaccine manufacturers, to let us know when they can deliver the vaccine. In particular, for BioNTech, the logistics is actually very challenging because of its minus 70 degrees storage of the vaccine. So I think that is also crucial. Now, of course, we are trying our very, very best in terms of curbing the epidemic, but as most of our experts have told us, because of the winter season, actually the virus is very strong in winter. So therefore, even before the fourth wave, we have already been preparing for the fourth wave in terms of our capacity, in terms of our various measures. And so therefore, the fourth wave is actually coming down, but it is not as fast as we would like to be. In the recent few days, there is some hiccups, especially when we have more cases in the Yau Ma Tei area, and we have very quickly put in measures in identifying a designated area and do a lot of compulsory testing. And most recently, we have also put in a core area within the designated area, so that we actually are testing every single building, even when they have no cases. We are working on it. So I think all these measures are effective if in our past experience, especially in the previous waves. So it's really a matter of time. And also a matter of cooperation of the entire community, which I must say, I must express my thanks, to the people of Hong Kong, because they have been, most patient and also most cooperative, generally, in terms of the infection control measures. Well, I think we have throughout the epidemic control and measures. So it's been a year. So we have always been listening to comments and also criticism sometimes, from people, from legislators, from the general public, and also from the professional community. But these are not all criticisms. I think most recently there has been criticisms, but we have also received a lot of encouragements. We have also received a lot of commendation. For example, I think especially during the when we have successfully curbed the second wave and also the third wave, we have been receiving a lot of interviews, from different, especially overseas media, to ask, how did we do it, and also try to ask us for an example. But of course, we are very humble in all the comments, whether it is encouragement or whether it is criticism, that we would listen, we would try to reflect and also review what we have done. And if it is something that there is room for improvement and response, we would quickly do it. So I think we would always continue to do this. And I think throughout the past year, we have been working extremely hard, not only myself, but also all my colleagues, in the Food and Health Bureau and also the Department of Health and Hospital Authority. Especially, I think the frontline, healthcare professionals, they also have been working very, very hard, all with one goal, is trying to curb the epidemic. Well, I think this has been the most challenging, epidemic, not only for Hong Kong but also for the rest of the world. It's a pandemic, it's a global pandemic. When the global pandemic will end, we are not sure. But I'm sure, with the experience that we have gathered from the past year, that there must be, more for us to do, and also to prepare, if there is another virus, coming, or another epidemic of a different nature. Because throughout the past year, we have been developing or building a lot of capacity, both in terms of our hardware, the hospital, the isolation facilities, quarantine facilities, as well as our software. I think we have all learned, more, not only the virus, but also the control and also control measures, and what is effective and what is not effective. So I think we are, getting more and more knowledgeable in terms of this. And third, I think it's also our research. So the Food and Health Bureau has been, funding a few rounds of research for the epidemic, and I'm sure, the outcome of the research would provide or advance, the science in curbing, further epidemics if this is going to come. And finally, I think the technology of vaccine is also something that I think the entire world should be proud of, because within a very short time, these vaccine manufacturers have been able to come up with the vaccine, which will shed a lot of hope for the people in Hong Kong and globally as well.